Bonjour tout le monde. Good morning, everyone, and thanks for joining us. I'd like to acknowledge that I'm speaking to you from the Treaty 13 lands of the Mississaugas of the Credit First Nation and just reaffirm the Ontario Green Party's commitment to the truth and reconciliation process. It's safe to say that everything is not okay in Ontario. The past 2 years of the pandemic has taken a toll on the people of Ontario's mental health and well-being. That's why today, on the first day of the spring sitting of the legislature, I will be tabling a motion in the House that will call for a significant expansion of mental health services covered under OHIP. For far too long, mental health has been an afterthought for the Ontario government, and the crisis is getting worse under Doug Ford's watch. Lack of access to affordable care is hurting Ontarians in their wallet, and wait times are getting worse. It's clearly unacceptable if you show up at the hospital with a broken arm and you're told that you'll have to wait weeks for the care that you need. But that's precisely the challenge facing far too many Ontarians attempting to access mental health care. We simply cannot sit by and let it continue. Ontarians deserve better. Mental health care needs to be affordable and accessible. It needs to be a priority, not just a footnote in budget bills. You know, the Ford government has proposed spending billions on super sprawl highways like Highway 413, yet mental health services in this province do not receive the funding necessary to provide timely, accessible, and affordable care for the people of this province. And here's the bottom line. Mental health is health. And it's about time we start treating it that way, because everything is not okay in this province. Mental health is as important as physical health, and that's why its coverage needs to be expanded under OHIP. People shouldn't have to wait months, sometimes even years, to access the mental health care they need and deserve. Ontario Greens know how important mental health care is. And that's exactly why my first act in this sitting of the legislative calendar is to table this important motion calling for the expansion of OHIP services, mental health services covered under OHIP. And I call on my fellow MPPs from all parties to work across party lines to ensure that Ontarians have access to affordable, timely mental health care and services. I want to thank you for joining us today, and I'm happy to take any questions.
What do you think are the chances of this motion passing?
Well, we'll see. The government has indicated at times that they have a commitment to mental health, and so the bottom line is here's an opportunity for the government to show its commitment to mental health by expanding coverage under OHIP. The bottom line is, as I've said, mental health is health, and it should be covered under OHIP in the same way physical health is.
Trying to get this passed. What have you sort of background work have you done on this?
Yeah, so I've had I have a high regard and a great deal of respect for the Associate Minister, and hoping that he and his colleagues will give this motion due consideration and support.
Questions on the phone line?
Ladies and gentlemen on the phone, as a reminder, if you do have any questions, please press star 1. There are no questions on the phone.
Great. Thanks, everyone. And welcome back to the legislature. I hope everyone had a wonderful break, and looking forward to seeing everybody back at Queen's Park today. Merci.